Hello, Mr. Petru.
Hello, doctor.
Hi, have a seat.
Thank you.
So, how are you today?
I'm okay, I'm well.
It's been a while since I last saw you.
It has.
So, how have you been?
Busy. Life.
How is your family?
They're well. The boys are taking up a large part of my time.
Okay, so how old are they now?
They're teenagers, that's
Okay,
why. Yeah.
that's difficult time. How are you handling this?
Hanging in there, but the restaurant takes up the rest of my time, so it's not like I have much free time at all.
How is your business going?
It's going very well. You should come.
Yeah, I'll try and come one day. Yeah.
Okay.
Good. So you've been to the Wellman Clinic last week.
Yes, I have.
This is your first time, yeah?
If it was up to my wife, I would have been there 5 times already.
Okay. So what made you come this time?
Well, honestly, apart from my wife, it was the diagnosis that my elder brother got of a heart problem, angina.
Okay.
So that's very sobering for him and scary for me.
Yeah.
So I brought myself in. I made time.
That's unfortunate.
Yeah.
And do I remember right that your dad died a couple of years ago?
It was 2 years ago, almost to the day. Stroke, very sudden. Very traumatic for the family.
Yeah, I remember you had a very tough time, you and the family. Yeah, but that's why we're here today, because we want to make sure that we reduce the risk of this happening to you. Good. Okay, so before I go into your results, can I check what the nurse told you last week when you were here in the clinic?
Yeah, she said she was going to draw blood to take cholesterol levels, and she said that my blood pressure was okay, and that I was overweight, as if I didn't know it.
Yeah.
I run a restaurant, of course.
Yeah, of course you do, and you've got good food there as well. So.
Very good food.
Okay. Well, okay. So did you explain why we're doing this test, though?
It was a checkup, just to see how my health is.
That's very right. I mean, it is a checkup, and it's a checkup that is a little bit specific for your heart. Okay, so we're trying to screen you for different risk factors for developing heart disease in the next 10 years. Okay, so in your right, you had some blood tests to check for your lipids, and you also had we had it checked for your blood glucose levels as well. And in terms of your cholesterol and triglycerides, those were a bit on the high side.
They were.
I'm afraid. But in terms of your glucose levels, those were okay. I mean, they were within the normal limits. I mean, you could do better, but at least they were within the normal limits.
That's good.
Okay, but it's not just those. I mean, we looked at all your risk factors together, because basically what we're trying to do is get all your risk factors for heart disease, put them together, and come up with a prediction of how likely you are to develop heart disease in the next 10 years.
Oh, you can do that.
I mean, we bring together different risk factors like your history of having high blood pressure, your family history of heart disease, your cholesterol levels, your blood glucose levels, and also smoking, I'm afraid. I can see here you're still smoking.
I'm still smoking. Unfortunately, the answer is yes, but I have cut back.
That's very good to know.
They don't let it happen anymore in the restaurant, so I've cut back. But I still smoke.
Yeah, but you must be proud about your achievement, because at least
you're doing
it's less than before. So yeah, I mean, and I know it's a big challenge to reduce your smoking. So you've done really well there. Okay, well, when we bring all those risk factors together, then as I said, we calculate what is your risk of developing heart disease in the next 10 years. If, for example, we take 100 people your age without any of those risk factors, okay, we expect about 6 out of 100 to develop heart disease within the next 10 years. Yeah.
That's high.
It is high, but I mean, as we grow older, our risk of having heart disease increases. I mean, it's unfortunate, but this is what age does to us, okay? In your case, because of all the risk factors we've discussed, okay, if we had 100 people like you with the same risk factors, we would expect about 20 to get heart disease in the next 10 years.
That's surprising. That's quite a jump.
It is a jump. That's why we're having this meeting today, to discuss ways that we can bring your risk down.
Okay.
How do you feel about that?
I feel good. Last time I had a talk like this, they said, you have hypertension, here's your pill. Is there something like that today?
There is medication that we give to lower your blood lipid levels.
Okay, that's good.
Yeah, but apart from that, we need to be discussing as well and thinking about other changes that you could be making to some of your behavioral factors, lifestyle factors that could also help to reduce that risk.
Like stopping smoking, you mean? Stuff like that?
Not just smoking. Smoking is one of those, but we could discuss how, your diet, physical activity, and those kind of things.
It's that talk. Okay. My wife has this with me often.
Okay. Yeah, I know it's difficult, and I know a lot of you always say, you doctors tell us not to do this, not to do the other. But
we do.
Yeah. But it's how you do it. That's the main thing, okay? So how important is it for you to be healthy?
Look, after my brother's diagnosis and losing my father 2 years ago, I can't afford to go down that path. And I mean, God is ringing a bell, do something, so.
Yeah, and that's why we're here for you as well, to help you in that, okay? And it's a big step that you're doing today, coming here and acknowledging the fact that there are some things that you could do to change your risk, okay? Have you thought of any areas that you could focus on to begin with?
No, honestly, I haven't. I was hoping that we could add some medicine in, and that would be a good first step.
Okay, but in terms of the other areas, I mean, in terms of the diet, the exercise, the smoking, have you had any thoughts of what could be some realistic first steps?
The smoking, I honestly don't think I can cut it back after the recent cutback, so it'll take a while, and then maybe I can think about that again.
Yeah,
the other two I haven't honestly thought about.
Okay, would you like to hear more about it?
I'd like to have more input for my thought process, yes.
I mean, what we could do is that I could give you some information that you can read at your own time.
Okay.
And what I would like you to do is kind of think about small steps that you could make towards a direction that will improve your habits. Okay, what we know from other patients and from the literature is that if you as a person decide what's feasible, what's realistic for you as next steps, and you set your own goals, then it's more likely that you will achieve and sustain them.
It has to be doable, that's the thing.
Exactly.
You have to be able to fit it in.
Exactly. It needs to fit your lifestyle.
My wife joined the gym. She's now blocking out time to go. I can't do that. I can't leave the restaurant alone to rush off to a gym. So it has to be something that is doable.
Okay, and that's why you need to come up with ways that are compatible with your everyday life. I mean, some people, for example, are telling us, I mean, people like you who are busy, they're telling us that what helps in terms of getting a little bit more exercise, for example, is to walk to work rather than get the car. I mean, I don't know whether this is something that you could do. It might not be for you, but this is something that works for other people. I mean, these are the kind of things that you could be thinking about. What do you think?
I don't know. I mean, I never thought about it. It was always my alone time, and I listened to the news driving in. I don't know. Maybe. I'd have to try it to see. But when you say exercise, is walking enough?
Well, I mean, you could start with walking. I mean, what we mean about with exercise is that, I mean, there are several things that you could do to improve your
physical. I'm on my feet all day at the restaurant.
And that's very good, actually, because you are limiting your time sitting on a chair, which is very good. But our body needs a little bit of more intense exercise as well. Our heart needs that, okay? And walking, cycling, running are kind of things that we could do to help with that.
Yeah, I'm not going to bike to work. But we'll see.
I mean, this is the kind of things that you need to be thinking when you are reading through the stuff that I'm going to send you. Okay? Is it okay if I give you, I mean, one option is to take leaflets from here, or I could send you some links to websites that you can read on.
No, links is fine. I'm on my iPad all day.
I could send them to your email. I mean, I've got your business email here. Is that okay?
That's fine.
I mean, the main purpose of our meeting today, it was just to initiate this discussion, okay? To initiate a discussion of how you as a person can see yourself in the next 10 years and how you as a person can think about changes, little steps at a time, okay? So what we could do is that you can read that material and then we can meet up again.
I'll do that. When? How soon do you think?
It is a month long enough for you to get.
It should be okay.
Okay, so we could book an appointment in a month's time, and you get your time to kind of read through the material, and then we can think about small changes, small goals at a time on how you can improve your health.
Baby steps.
Baby steps. Yeah.
Sounds like a plan.
Good. Well, it was a good start that you've come here today. I'm pleased you've come. Okay. I'm sure we'll be able to help you if you are ready to make the changes yourself. Okay. So we've got a plan then. Okay. Let's go to the reception and we book the appointment.
Let's do that.
Just follow me.